gap in life expectancy between the richest and the poorest country now exceeds 14 years, in large measure owing to the toll of infectious disease, safe water supplies, sewage treatment and disposal, improved food safety, and vaccination. Barrier to achieving this improvement is the underlying weakness of public health system in resource-poor countries, including a shortage of healthcare workers, which hinders effort to immunize, treat, and monitor the status of patients. This concern, a strong public health infrastructure achieved through leadership at country level is needed. Activities promoted by leaders include developing strategies for improving health literacy, which can be achieved by providing educational opportunities to local healthcare professionals. Poor nations also lack disease surveillance programs and up-to-date laboratories, which are essential to the mission of finding, diagnosing, and containing infectious disease.
Of further concern is the fact that life-saving vaccines and medications are not distributed equitably around the world. More than half of those suffering from HIV or AIDS who need drugs treatment are not receiving it. About 23% of people with multi-drug resistant tuberculosis received the right medication in 2014, an increase of 14% from the previous year. Yet, only 50% of this group was treated successfully. 16% died, 24% did not have their treatment document or it was interrupted, and in 10% of the population the treatment failed. And while children in wealthy countries are routinely immunized with vaccines that protect against childhood pneumonia and diarrhea, children in poor countries are not. For each child who died from pneumonia in an industrialized country, more than 2,000 children die from the infection in developing countries. Many factors influence whether poor nations can obtain affordable drugs of good qualities. Most drug research and development is not geared toward the needs of people in poor countries because they are not a big market. As a result, a large percentage of the money spent worldwide on healthcare research is dedicated to problems affecting a small percentage of the world's population. Social and political challenges to the distribution of medicine are a factor as well. Foundations, pharmaceutical companies, and other organizations are making effort to overcome these challenges by providing funding, research, and donation of medications. The tragedy of global infectious disease is not only that so many lives are lost or damaged, but that so many of these infections could be prevented or treated effectively with low-cost drugs. The rich countries have engaged in vaccine nationalism, paying for doses in short supply in quantities that more than cover their own population. When it comes to saving lives, leaving the distribution of vaccine purely to the market is absurd, as no one is safe until all of us are safe. There is no doubt that the rich country, perhaps with funding and assistance from the World Bank and regional development banks, must assist developing nations in getting enough vaccine and getting them fast, such as India and Pakistan.